Hello Noobs, so we have started a new podcast for auditory listeners and it will be available on every major platforms. Please kindly hit the follow button and subscribe our YouTube channel for the daily updates. Hi all, today we are going to discuss regarding postpartum hemorrhage. What is postpartum hemorrhage? Postpartum hemorrhage is more bleeding than normal after the birth of a baby. About 1 in 100 to 5 in 100 women have postpartum hemorrhage. It is more likely with a cesarean birth. It most often happens after the placenta is delivered, but it can also happen later. Who is at the risk for postpartum hemorrhage? Some women are at greater risk for postpartum hemorrhage than others. Conditions that may increase the risk include placental abruption, placenta previa, symptoms of postpartum hemorrhage? Uterus. These are the most common symptoms of postpartum hemorrhage, which disorders of pregnancy, uncontrolled bleeding, having decreased blood pressure, prolonged heart rate, infection in the red blood cell count, use of forceps or vacuum in the vagina and nearby Asian or bleeding Hispanic ethnic from background. A hematoma. How is postpartum hemorrhage diagnosed? Your healthcare provider will review your health history and do a physical examination. Lab tests often help with the diagnosis. Other tests may include estimate of how much blood you have lost, measuring pulse and blood pressure, RBC count, clotting factors in the blood. How is postpartum hemorrhage treated? The aim of treatment of postpartum hemorrhage is to find and stop the cause of the bleeding as soon as possible. Treatment may include medicine or uterine massage to stimulate uterine contractions, removing pieces of the placenta that remain in the uterus, examination of the uterus and other pelvic tissue, the vagina and the vulva to look for areas that may need repair, Bakri balloon or a Foley's catheter to put pressure on the bleeding inside the uterus. Your healthcare provider may pack the uterus with sponges and sterile material. This may be done if a Bakri balloon or Foley's catheter is not available. Laparotomy, trying off or sealing bleeding from vessels, and hysterectomy also. Replacing lost blood and fluid is important in treating postpartum hemorrhage. You may quickly be given IV or intravenous fluids, blood and blood products to prevent shock. Oxygen may also help. What about the nursing management of a woman with PPH? Nursing diagnosis for PPH include fluid volume deficit related to vaginal bleeding, ineffective tissue perfusion related to vaginal bleeding, anxiety or fear related to the changes in the circumstances or the threat of death, risk for infection related to bleeding, risk for shock, hypovolemic related to bleeding. Nursing management of third stage hemorrhage, palpate the fundus and massage, IV fluids, oxytocin or methergine, catheterization, controlled cord traction, if not manual removal of placenta. Nursing management of true PPH, methergine or oxytocin, examine placenta and membranes, exploration of the uterus, bimanual compression, uterine tamponade. Thank you all. Have a nice day.